Hi, everyone. I'm Paula Harvey of Tejon Ranch Conservancy, and this is another installment in our interviews with career science people. Today, we're speaking with Dr. Sean Jenvay, who is a psychiatric resident at UC San Francisco. Welcome, Dr. Jenvay, and thanks for taking the time to speak with us.
Thank you.
Can you start by telling us a little about the field of medicine that you have gone into?
Yeah, absolutely. Medicine is a broad area, and there are a number of different specialties or subfields you can go into. The main ones people think about often are things like cardiology or gastroenterology. My specialty is psychiatry, which is essentially a specialization in mental health, and so I get to do work that is really focused on looking at patients as a whole person. Thinking about their thoughts, their feelings, their upbringing, their life experience, and how that all adds up to how someone is feeling and thinking now. So I help people with issues like depression, anxiety, and even more severe issues like schizophrenia or bipolar disorder, things that people might have heard about. And so the way that I do that in my field as a doctor is through a combination of things like therapy, like talking with someone and interacting with them, but also through using medications and other kinds of techniques that are kind of previously developed and upcoming now. It's a very exciting time with new kind of treatments coming out to be able to help people to manage these things and to live life as best as they can.
Great, thanks.
Mhm.
Why did you decide to go into medicine?
Yeah, so medicine was a big choice for me. I made that choice in college is when I really became kind of committed to it, but it was something that was on my mind in the years before. The main, I think, kind of way to summarize it for me is that I had a very big appreciation for the sciences, which began kind of as a curiosity in high school and really blossomed into something much more passionate in college. But I also had always imagined myself doing something service oriented towards helping people. And I also, had considered doing something where I would be, doing more like research, and I could, use my research to help people. But after doing a little bit of that in college, I really determined that I was someone who needed to interact with people face to face, and I wanted to be there, looking into the eyes of people that I was helping. I really value that kind of interaction, and so medicine was a way for me to marry, kind of an interest in the sciences and the a desire to kind of use that knowledge to help people with actually having this day-to-day face-to-face interaction with people that I'd be working with or working for, and that was very attractive to me.
So tell us a little bit about your educational path, perhaps starting at high school.
Sure. I was at high school at Fairtree Mountain High School in Southern California. It's a relatively small school, and I'm from a small town. And I was going to be going into the big world of college and everything. And at the time, I didn't know a tremendous amount about that. But what I knew is that I would need to take advantage of any opportunities that were available to me. And so that was kind of one of my big goals in high school was to try to take all of the classes that were available, even if they were more challenging, to try to get involved in extracurricular programs and clubs. And I really had a pretty big appetite for that in high school. That helped me a huge amount to kind of get me going out into the world. When I applied to college, I didn't really have a big sense of what the college landscape looked like at a national level. I applied mainly to the UC system, which was my main goal, and I was very thrilled to be accepted to UC Berkeley and a few other UCs. And I really attribute that success of getting that acceptance to kind of how I went about my high school time. that I really wanted to put in the work at that point in high school so that it would be able to serve me well down the line. And it has. So, after high school, I went to UC Berkeley in Northern California, which is right near San Francisco. It's a wonderful public university. And I was there for 4 years for my degree. In Berkeley, when I first got there, I did take a little bit of a breather just to get adapted to, being at a college level and at a big college. But after that, once I kind of found my footing, I again started, trying to take anything that I could, and also getting involved in clubs and extra programs to kind of help me along the path. And part of college is finding out what your path is going to be. I already mentioned in my part that it helped me to understand that I wanted to do medicine. And so, some of the things that I chose to do were kind of geared towards helping me with that pathway. And ultimately I did, make that plan to go into medical school. I took a little bit of time off after college to work. My last degree, my last time in school per se that I've been in was 4 years in medical school. So that's this, high school, 4 years of college, and then 4 years of medical school, which has led me to where I am now, which is working as a doctor. And my job is called a resident physician.
Great. And where did you go to medical school?
I went to medical school at Northwestern University, which is in Chicago, in Illinois. I will say I did not plan necessarily to be in Chicago. I applied to Chicago mainly out of a sense of curiosity. I was very taken with it when I was there, both the program and the city. And I wound up attending Northwestern, for the 4 years, and it was a really wonderful experience. I was fortunate to have actually a friend from home who had also found his way to Chicago, and I made a bunch of new friends on the way. I really fell in love with the city there. But after 4 years, even though I truly enjoyed Chicago, I did want to try to move back towards California to be closer to my family. Yeah.
Yes, and that friend just happens to be Dr. Scott Beering, whom we interviewed before, who is a researcher at UC Berkeley. So that connection stayed together, which is pretty remarkable given the small town that both of them came from. So tell us a little bit about extra things that you did that got you through your medical education.
Sure. So I think the things that I did that were extra that really helped with my medical education began really in college. Things that I did in high school, as I mentioned already, helped me to get to that point in college. But as far as gearing towards medicine, that kind of began when I was an undergraduate. And so things that I did, there's kind of a few different things generally for people who want to work in medicine. And this has to do with the fact that, as I kind of mentioned earlier, that medicine really is a combination of sciences, but also with service and interpersonal interaction. So generally for people who want to go to medical school, you are looking into doing some type of medical work where you're usually volunteering at a hospital to kind of get used to what that is like, to be, at least in some circumstance, a care provider for people. So I did hospital volunteering at local hospitals during college, which is a very common thing and anyone can do. I also worked at a research laboratory, a few research laboratories actually in college, which is also very common at an academic university. And I worked in biology laboratories primarily, but other people I know who are in medicine and who are on the way there at that time worked in a variety of different labs. But my interests were in biology, so I worked in a few different biology labs. And aside from that, I did some extracurricular clubs that were kind of themed towards medicine. Being pre-med at college is a big, identifier, and, is usually an experience that most colleges have. And so there were clubs that were specifically geared towards being a pre-medical student. And they helped me to kind of get to learn more about medicine, about different areas of medicine. We got to do things like touring medical schools or hospitals in the area nearby, which were very, very helpful as well. And then actually one thing I did to kind of further that aspect of kind of trying out being a care provider, is at my college, excuse me, there was actually a program to train undergraduates to be emergency medical technicians, or EMTs, which I pursued while I was in college. I think in my junior or senior year. And so I did a program to get trained and certified as an EMT, which later actually helped me with work in between college and medical school.
Oh, great.
Mm-hmm.
So that's great. So you were very dedicated to making sure that everything that you did wrapped around your goals.
Yeah. Yeah.
So, talk a little bit about the kinds of challenges you faced. Going into the medical field can't be particularly easy.
Yeah, it's definitely challenging. I would say the challenges, I feel like, did start relatively, early. I mentioned that I had gone to a relatively small school, and that does have some challenges because, getting into, colleges from a small school kind of requires you to really take those opportunities that I mentioned earlier. You really want to do everything you can, and to say yes to things. And I think that was the main way that I dealt with that challenge. And it is totally a surmountable challenge. At the time, I used to feel, I remember when I was in high school, I wasn't sure what it would lead to, but I have to say, I really value the fact that I went to a smaller place in a smaller area, actually, because I think it actually keeps my feet on the ground a little bit more than some of my peers who I've come to know who went to bigger schools and had fancier experiences. And I generally feel that, especially as someone who works with patients and is a care provider, that oftentimes patients appreciate that aspect as well, that you're someone who is a little bit more grounded. So at any rate, moving on from there, going into medicine is generally, competitive in the sense that there's a lot of people who want to do it. And so, a lot of what I had to do in college to kind of make this happen was kind of continue the attitude that I had in high school of trying to say yes to things rather than no, and just to really have a good amount of work ethic to try to make sure that I was continuing to, do what needed to be done, that I was able to study enough, and that I was able to, have the experiences that would eventually help me when it came to, an admissions process or something, So experiences like the things I mentioned, like volunteering or working in a lab, or, getting any kind of special experience like I had being an EMT. And, that was a big thing. The other thing that people often think about for medicine, which is true, is that medical training is quite expensive. And that certainly was an obstacle. I, in applying to medical school, was surveying, how much money it was going to cost. And, it really seems like no matter where you go to medical school, the bills are quite high, and the debt was a little intimidating. I will say, so almost all schools have a pretty strong financial aid program because they are aware of how challenging the finances can be. The other thing I will say is once you finish your medical training and you start working, the government and a variety of employers, so like hospital networks and other places you can work as a physician, are also aware of this issue with debt, and there are programs in place to actually help people pay off their loans. And it's kind of a matter of just exploring these a little bit, but a lot of them will be presented to you as you're kind of going along the path, just because everyone needs a little bit of help with this. And by and large, the truth is, with doctors, you take on a large amount of debt along the way, but ultimately, you will be able to pay it off with time. And it is something that is manageable along the way.
Good. Thank you for mentioning that part. So tell us what your next steps are within the next 5 years. What does your career path look like?
Yeah. So right now I am, as we've mentioned, a resident physician, and what that means is that you are someone who is in the first few years after medical school. So I am able to work independently as a doctor, but generally speaking, I am technically under the supervision of what's called an attending physician, which is someone who's several years out from residency. So for me, my residency program lasts for about 4 years, which is typical. Everyone has to do a residency after they finish medical school if they want to work as a doctor. Almost all of them are around 4 years. Some can be longer, some can be slightly shorter. And after that time that I finish, I will take my first job as an attending physician, and that could be in a hospital, or it could be in a clinic, or it could be in a mixture of the two. There's a little bit of leeway for me to decide how I want to work. So one thing that I can also do if I would like, and this can happen either before I take a job as an attending physician or at some point down the line, I can also pursue extra training. So might seem hard to believe that I would want extra training after all of the years, but essentially you can do an extra training called a fellowship, which is usually 1 or 2 years, where you're able to get like really specific expertise in some kind of field. So typically, for me, I'm studying psychiatry, and as my residency, I'm becoming a specialized provider in mental health. But after this residency, I can do a fellowship to become a subspecialized provider in mental health, where I could do something very particular and really focus in on a certain subject area that I find most interesting or that I want to work with. That's not necessary, but it is something else I could do. And so essentially, either as a fellowship or as an attending, I will really be kind of starting, and I guess I've already started my career, but I'll be starting it kind of more properly, where I'll have a position that doesn't have a fixed endpoint. Up to now, I've really been doing programs that end after a certain amount of years, and it's known. At this point, I'll be working, and I could, really be having my job, what will be my job, for quite a while. So ultimately, I'll be doing that, and then other things that are happening in my life. I am partnered, and I'm planning to be married coming up. I'm hopeful to start a family at some point in the next 5 years. These types of things are difficult to do while you're pursuing medical training. There are people who do it, certainly, but for me, that's kind of where it's going to fall. Yeah.
Great, thanks, and congratulations. So last question, do you have any advice that you can give students who might be interested in a career in medicine or a career in science?
Yeah, definitely. So I think some of this is, I've already kind of touched on as I've gone on here, but I think the best advice, really is to have that attitude of saying yes to things. That I've kind of used that phrase already, and I think it's a good one. Pursuing a career in the sciences, and in any sciences, and I would say especially in medicine, really kind of is best done if you have that attitude, where you are going to be able to put in the work at the right times, and it's a really valuable time, especially earlier on, high school and college, to ensure that you will have the opportunities to come down the line. And so it's really about taking advantage of that time, making sure that you are putting yourself out there, trying to find those experiences and trying to take on the work. You never want to overburden yourself, and it's something to be watchful for. But it's so critical to make that effort to try. Because you're not going to know how something will go unless you really put yourself out there first. And so that would be my main advice, would be to really when you have the opportunity to do something a little extra, or something that's kind of interesting to you, to really take it on, and give it your best shot, especially in the earlier parts of your path.
Great. Thank you so much, Dr. Jenvay. And we really appreciate the time that you have spent with us. And I'm sure that the people who are watching this video got some great tips about how to follow their career path. Really appreciate that.
Yeah, no problem.